So remember when you used to have family dinners, enjoying that second plate of food, and suddenly your mom starts listing every disease that has ever existed in your whole entire family? Or she starts talking about that uncle that had diabetes, or that auntie that has high blood pressure, and even that your mother's brother's cousin with a heart problem. And now suddenly you're thinking, damn, am I next? We've all been there, and I'm sure you know what I mean. But here's the good news. Just because it runs in your family doesn't mean it has to run in your life. And today, we're talking about some of your genes and what it actually means to be Black and healthy. I'm going to share some practical tips you can use right now to stay healthy without sacrificing flavor and the joy of life. So stick with me, because by the end of this video, you realize your health is way more in your control than you think. Let's break it down. So let's clear something up. Just because you're Black doesn't mean you're doomed to high blood pressure, diabetes, or a heart attack. I hear people say things like, well, it runs in my family, so there's nothing I can do. Think of it like this. Genetics is like a loaded gun, but lifestyle is what pulls the trigger. Yes, certain conditions are more common in Black communities, but a lot of what we think is just in our genes is actually about our environment. And other things like our diet and stress, or even our access to healthcare and health inequalities. So let's break some of this down. All right, let's talk about the big three, the health issues that hit Black communities harder than others. You've heard these things before, but today we're going to unpack why they actually happen and what we can do about it.
Blood pressure, which seems to rise each time you leave the house.
Hypertension is like that thief in the night. You don't realize until the damage is already done. It's called the silent killer for a reason, and it's because most people don't have symptoms until it's too late. Now, some say Black people are genetically predisposed to high blood pressure, but here's the tea. While there are some genetic factors, lifestyle still plays a huge role. Let's talk about salt sensitivity. Some Black people's bodies hold onto salt a lot more, which raises blood pressure. But the real problem is things like processed foods. That bag of chips, that takeout meal is all loaded with sodium. Another thing we need to talk about, especially in the Black community, is stress.
I don't like stress.
Chronic stress from daily microaggressions, workplace pressures, and financial struggles, and other things that cause stress can literally raise your blood pressure over time. Now stick with me to the end of this video, because that's when I want to dive into solutions and things that we can try and do to try and improve our health as Black people and as Black patients. I'd appreciate it if you could like and subscribe so I can bring you more of these sort of videos so that we can all learn about how we can improve our health for longer. Now, I know we love our comfort foods, that mac and cheese, that sweet tea, that pounded yam. Yes, you know what I'm talking about. Listen, look, I'm not trying to say you have to give it all up, but we have to be real about the risks. Black adults are twice as likely to develop type 2 diabetes. And this isn't just about genetics. Sometimes it's about food access. Some studies have shown that many Black communities have more fast food chains than grocery stores. Now, we have to also talk about misinformation, because a lot of us, including myself, grew up thinking that eating a good meal meant a plate full of rice and meat. Can't forget the meat. But really and truly, our bodies need a balance, and we need to have a balanced diet in order to stay healthy. Another issue is lack of healthcare access. Many people in the Black community don't get diagnosed until it's serious. So please make sure you get checked out. So you know how they say Black don't crack?
Black don't crack.
But unfortunately, Black hearts do. Literally. Heart disease is the #1 killer in Black communities. Why? Well, it's a mix of everything we've already talked about: high blood pressure, diabetes, stress, diet, lack of exercise. But here's the good news. Even small changes can make a huge difference. You don't need to be a gym rat. Just walking 30 minutes a day cuts your risk. Now, this is something we really have to talk about, because Black people often receive worse healthcare than white patients. For example, did you know that Black women are 4 times more likely to die during pregnancy or childbirth compared to white women? Studies have also shown that Black patients are less likely to get pain medication. For example, a 2015 study found that Black children with appendicitis were less likely to receive pain medication compared to white children. This is often due to the fact that doctors sometimes downplay our symptoms because black pain is often underestimated, which leads to inadequate treatment. A 2016 study revealed that some medical professionals hold false beliefs about biological differences between black people and white people, or black patients and white patients, affecting their treatment decisions. Even medical devices can be biased. For example, pulse oximeters. You've probably seen one of these before, and they measure oxygen in the blood. And they've actually been shown to be less accurate for darker skinned individuals or for black patients. Now, this might sound like doom and gloom, but that's exactly why advocating for yourself is so important. Because as long as health inequalities exist, we have to take control of our own healthcare. Now, I want to give 5 tips for navigating healthcare as a black patient. Now, listen carefully because I think every black person can benefit from one or two of these things. Number one, advocate for yourself. Speak up if something feels off. Don't let a doctor dismiss your concerns. Ask questions and demand clear explanations. Number two, know your health stats. Stay on top of your blood pressure, your blood sugar, your cholesterol level, and your BMI to catch issues early and push for proper care. And if you don't know what your numbers are, find out because it's really important. Number three, get a second opinion. If a doctor downplays your symptoms or ignores your concerns, ask to see another doctor. Your health is too important to take chances. Number four, bring support and take notes. A friend or family member can help ensure that you're heard. Write down what your doctor is saying in terms of advice, your test results, write them down, and what the next steps are, write them down too. Number five, prioritize preventative care. Now, this one's also super important because, as my mum would say, prevention is better than cure. Don't wait until you're in pain before you see the doctor, and don't skip screening invitations or health checkups. All right, so we've talked about some of the risks. Now let's talk about some of the solutions. Now I know we love flavor, but too much salt and sugar are hurting us. Cut back on salt by using things like garlic or onions, or even smoked paprika, and swap things like soda and juice for water or even herbal tea. Stick to real foods. Our traditional meals, greens, beans, lean meats, are already healthy. Just cut down on the processed foods. Balance your plate. If you're eating rice, add beans and greens. If it's sweet potatoes, pair it with salmon. For a healthier heart, eat more salmon, nuts, olive oil, and leafy greens. And make sure you cut back on the fried foods and sugars. And also, drinking water is so important because dehydration leads to cravings, fatigues, and even headaches. Now, exercise doesn't mean hitting the gym every single day. Just move or do things like walking, dancing, jump rope. 30 minutes a day is all it takes. Put on music and dance for 10 minutes. That's really good for cardio. Strength training is key. Squats, push-ups, resistant bands, just a couple of times a week. Stretch daily, 5 minutes in the morning or before bed makes a difference. I think the key to working out is to find something fun. If you hate it, you're probably not going to do it. Dance, sports, hiking, whatever keeps you moving and whatever you enjoy doing. And don't sit all day. Stand up, take the stairs, or walk after meals. Keep your body in motion. All right, guys, listen to me. You need to take control of your stress levels. Use therapy, meditation, journaling, whatever works for you. One thing I've noticed in the Black community is that there's always been a stigma around therapy. They really shouldn't be. It can literally save your life if it reduces your stress, reduces your blood pressure, and helps you to live a healthier life. You really need to protect your peace because stress can literally kill. Lack of sleep also doesn't help, so make sure you're getting at least 7 to 8 hours a night. As I touched on before, get your checkups early. And as I said, don't wait until you're in pain. Schedule that appointment now. So there you have it, guys. What does being Black say about your health? It says you've got challenges, but you've also got choices. Now, here's your next step. Drop a comment below and tell me one small health change you're making this week. And if you like this video, you'll probably enjoy watching this one. And please make sure you hit that like button and share this video with a friend and subscribe because we're all in this together. All right, guys, stay healthy, stay informed, and I'll see you in the next one.